The role of family in borderline personality disorder, BPD, treatment, importance of family therapy. Borderline personality disorder, BPD, is a complex mental health condition that can significantly affect an individual's emotional regulation, interpersonal relationships, and sense of identity. While therapy for BPD typically focuses on helping individuals manage their emotional distress, family therapy plays a critical role in the overall treatment plan. Involving family members in the treatment process can improve communication, foster understanding, and provide a supportive environment that is essential for healing. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the importance of family therapy in the treatment of BPD. Family dynamics often influence the severity of symptoms and the individual's ability to regulate emotions and interact with others. By engaging family members in therapy, both the individual with BPD and their loved ones can learn healthier ways to interact, communicate, and support one another. 1. What is family therapy and why is it important in BPD treatment? Family therapy involves working with the entire family unit, not just the individual with BPD. It focuses on improving communication, understanding, and relationships within the family, helping each member understand their role in the dynamic and how to support their loved one's treatment and healing. In BPD, family relationships are often marked by intense emotional conflict, misunderstanding, and unresolved trauma. Individuals with BPD frequently experience unstable relationships, swinging between idealization and evaluation of others. These shifts can be exacerbated by misunderstandings and a lack of emotional validation. Family therapy helps address these challenges by teaching family members how to communicate more effectively, reduce conflict, and build healthier relationships. Key fact: family therapy in BPD treatment encourages healing not just for the individual with BPD, but for the entire family, promoting an environment of emotional stability and understanding. 2. How family therapy helps in BPD treatment. 2.1 Improving communication. One of the most important aspects of family therapy for BPD is improving communication within the family. People with BPD often struggle with misinterpreting others' words and actions, leading to emotional reactions that can cause misunderstandings. Family therapy teaches everyone in the family how to express their feelings clearly and listen to each other with empathy and validation. Example: if a person with BPD becomes upset because a family member is late, family therapy can help the individual with BPD communicate that they feel neglected or rejected, rather than reacting impulsively. It can also teach the other family member how to respond with understanding rather than defensiveness. A key fact: family therapy fosters active listening and emotional validation, which are essential skills for creating a healthier, more compassionate family dynamic. 2.2 Reducing conflict and instability. Family members often feel helpless or overwhelmed by the emotional instability of someone with BPD. In turn, this can lead to conflict, avoidance, or inconsistent reactions, which only intensifies the emotional turmoil. Family therapy helps reduce these tensions by teaching family members how to set healthy boundaries, avoid blaming or judging behaviors, and provide consistent support. Example: if a family member with BPD reacts impulsively or aggressively, family therapy can help the family set clear, non-judgmental boundaries, such as, "We can talk about this when you're feeling calm." This reduces the chances of escalating the situation and provides a framework for consistent emotional support. A key fact: when family members set consistent boundaries and react in a calm, empathetic way, it creates an environment where the individual with BPD feels more secure and less fearful of abandonment. 2.3 Providing emotional validation. For individuals with BPD, emotional validation is often a missing component in their relationships. Family members, even with the best intentions, may not always recognize the depth of their loved one's emotional struggles, which can lead to invalidation and feelings of rejection. Family therapy teaches members to validate their loved one's emotional experiences, even when they don't fully understand or agree with them. Example: if an adolescent with BPD expresses feeling abandoned by a parent, a validating response would be, "I can see that you feel hurt, and your feelings are important. Let's talk about this." This helps the adolescent feel heard and understood, instead of dismissed or criticized. A key fact: emotional validation helps reduce feelings of shame and self-blame, which are common among individuals with BPD. It can promote a sense of safety and acceptance within the family. 2.4 Addressing family dynamics and conflict. BPD is often intertwined with complex family dynamics, such as enmeshment, dysfunctional communication, and history of trauma. Family therapy helps uncover underlying family issues that may be contributing to the emotional instability of the individual with BPD. These family dynamics may include patterns of over-involvement, neglect, or inconsistent discipline. Example: a parent with overprotective tendencies might inadvertently fuel the child's fear of abandonment by being overly involved or controlling. Family therapy can help the parent recognize these patterns and adopt more supportive, balanced approaches to parenting. A key fact: understanding and addressing family dynamics is critical in the treatment of BPD, as unhealthy patterns of interaction can contribute to the emotional dysregulation seen in the individual with the disorder. 3. Benefits of family therapy in BPD treatment. 3.1 Building a supportive home environment. In family therapy, family members learn how to create a safe, predictable, and nurturing environment that helps the individual with BPD feel emotionally stable. A stable home environment is critical for the healing process because it provides emotional security and encourages the individual to engage in therapy. Key fact: the supportive environment provided by family therapy can greatly enhance the effectiveness of individual therapy, leading to better long-term outcomes for those with BPD. 3.2 Improving relationship stability. Family therapy can improve relationship stability by helping family members understand the emotional needs of the individual with BPD and learn how to respond in ways that foster trust and security. This is especially important because BPD is characterized by unstable relationships and intense emotional reactions. Key fact: healthy, stable relationships are a key factor in the recovery process for individuals with BPD. Family therapy helps promote positive changes in how family members interact and support one another. 3.3 Empowering family members. One of the significant benefits of family therapy is that it empowers family members to participate in the healing process. By learning how to provide emotional validation, set healthy boundaries, and communicate effectively, family members can play a direct role in improving the quality of life for their loved one with BPD. Key fact: family members who are informed about BPD and equipped with practical skills can offer consistent and effective support, which is crucial for long-term success in managing the disorder. 4. Challenges in family therapy for BPD. While family therapy can be highly effective, it is not without its challenges. Family dynamics can be complex, and some family members may initially struggle with understanding the nature of BPD or may find it difficult to implement the changes discussed in therapy. 4.1 Resistance to change. Family members may be resistant to changing their patterns of behavior or may feel defensive if they perceive that the therapy is implying blame for the individual's struggles. Overcoming this resistance requires patience, understanding, and an open mind. 4.2 Managing emotional tensions. Family therapy can sometimes bring up difficult emotions, such as guilt, anger, or frustration. It is important for all family members to approach therapy with a willingness to reflect on their behavior and engage in open communication. This can help reduce misunderstandings and conflict within the family. 5. Conclusion. Family therapy plays a crucial role in the treatment of borderline personality disorder, BPD, by improving communication, emotional validation, and relationship stability within the family. When family members are educated about BPD and are actively involved in therapy, they can help create a supportive and consistent environment that promotes emotional healing and growth for the individual with BPD. By fostering a compassionate, non-judgmental atmosphere and addressing family dynamics, family therapy helps not only the individual with BPD but also the entire family system. It provides the tools needed for healthier interactions, greater emotional understanding, and more effective support, ultimately leading to better outcomes for everyone involved. In future episodes, we will continue to explore family therapy techniques, practical strategies for managing BPD symptoms, and how to create a supportive and healing environment within the family. Stay tuned for more insights on borderline personality disorder, BPD, and its treatment.